Well, in a minute, we're going to be watching you work with LC. Can you help our audience know what to look for and prepare for this interview?
Oh, absolutely. I was delighted to meet him. I took notes so that I would be sure to include the important things. This is a 53-year-old African-American man who has been divorced and has spent some time in prison, as he will explain. I liked working with him because he was not, he was somebody who is very sincerely invested in coming in and talking and working on his problems and his issues. I also liked working with him. Another reason why I've chosen this field is because there are so many underserved people, and he's somebody who's been clearly underserved by the system, by the treatment system. He doesn't particularly respond well to 12-step treatment, which is true for all treatments. There are a number of people who won't respond to any given treatment. But he had not ever heard of cognitive therapy or seen anyone who did cognitive therapy. He responded very well. But this is a gentleman who's had an addiction to cocaine, has had serious problems with drinking, began drinking at 13 years old, began using cocaine in prison. He'll tell his story, but what I want to really focus on here is that these cognitive processes don't just jump out of the patient onto your paper clearly and distinctly. The challenge in doing any kind of cognitive treatment is to know how to sort out what a belief is, what a thought is. People have some very subtle but profoundly important beliefs. Like he mentions in here that he doesn't trust people, that he doesn't believe that it's okay to show feelings, that he doesn't, that he sees himself as a drifter. These are views of himself, of the world, of other people that are essential in importance for the therapist to recognize, or else treatment won't be as effective. But they don't come out. They come out very subtly.
So we might look for what you think is important or what you pay attention to,
right?
Out of this complex case that he presents.
Yeah, the students I've worked with since I began to teach have said that they like watching me work or watching tapes, trying to pick up what they think is important, and then seeing where my intervention lies to see how aligned they are. So as this gentleman talks on the tape, I think it'd be important for anyone watching to ask themselves, what are his core beliefs about himself? How could a guy like this get addicted to drugs? He seems, and I think I even say this in the tape, he seems like such a sweet, good-natured, sensitive guy. How did he end up in prison? How did he end up committing serious crimes? How did he end up on drugs? So ask yourself those questions, but also keep in mind that this is cognitive therapy. So ask yourself, what were the core beliefs that led to this more than unfortunate, this tragic outcome for this man who's obviously gifted in many ways? So ask yourself, you know, what are his core beliefs that led to this, and how did he develop them? He seems such a dear man.
Yeah.